Hello, this is Dr. Batal, and today I will be talking about the skin tightening technology. Starting with the basic, the collagen is of paramount importance. It starts as helical polypeptides, which is protein that forms the microfibrils, which congregate to form the fibrils that in turn form the collagen. So it's a very strong fiber that gives the skin the structure and the strength. But after the age of 20, we start losing about 1% of the collagen every year. The elastin is another important protein that has contracted and elongated states. So it acts as a spring that gives the collagen the elasticity and the ability to recoil. In a younger skin, we have more fibroblast that produces more collagen. We also have more elastin fibers that's more interconnected with the collagen fibers, and also more robust hyaluronic acid base. In this three-dimensional structures of the dermis, you can see how the collagen and elastin fibers are very robustly interconnected in the sea of hyaluronic acid. The common risk factors for the skin fragilities is the heavy sun exposure and the smoking, and the high simple carbohydrate intakes, as elevated blood glucose could lead to glycation of the collagen, stripping it from its strength and characteristics. Of course, age and genetics. The main principle and the end product for the majority of the skin tightening technology is heat at various degrees. When heat is applied in the subdermal tissues at the fibroceptal network, the collagen and elastin fibers contract, producing a form of skin tightening. It also induces the fibroblast to produce more collagen and also elastin. The first and a bit older technology is the Smart Lipo laser from Cynosure. It produces focal heat at the tip of the laser of about 42 degrees. So it runs subdermally after liposuction or body contouring procedures in the fibroceptal network and burn some microfat in addition to coagulation of the fibroceptal network, but it's very safe. A BodyTite from InMode is a bipolar radiofrequency technology that runs the energy between the two probes. The internal probe produces a 70-degree focal heat internally and about 38 to 40 degrees externally. Because it's a higher heat, it produces more contraction of the collagen in the fibroceptal network, and you run the probe twice in each segment to augment the effect. It also melts the fat in the superficial plane and produces a better result than the Cynosure laser in the skin tightening. Another promising technology is the Renuvion J plasma, which is a monopolar radiofrequency running through a helium gas or a helium plasma. So what is plasma? As we know, there are four states of matter: the solid, the liquid, and the gas. But when you run an energy or electricity or radio frequency through the gas, the electrons separate from the protons, making that gas a transductor for that energy. A lightning is a common known form of plasma. When the energized helium plasma passes through the subdermal tissues, the plasma touches the fibroceptal network and produces an immediate 85-degree and effective shrinking of the collagen fibers in the fibroceptal network, And that energy is very focalized and does not spread into the superficial skin. So it has a very minimal and negligent risk of burning. Here again, the temperature in the photoreceptor network is an 85 degree, and it's very immediate and precise. So, and the temperature in the superficial skin can go to 40 or 41 degree. So it has minimal or no risk of burning. The purpose of this chart that the instant tissue contraction happens at 85 degree and above. Therefore, the 85 degree produced by the J plasma is very effective in producing an instant contractions of the photoreceptor network. I borrowed this slide from Dr. Buford, who is a big advocate for the J plasma and a consultant by them, that at 70 degree, that produced by the body tight, about 40% of the collagen contracts at 42 seconds. But at 85 degree, produced by the J plasma, about 60% of the collagen contracts in immediate 0.04 seconds. So it's been carried out as the advantage of the J plasma, which is very precise compared to the bulk tissue healing body tight. Of course, the other side has their arguments too. In this video, the J plasma is applied into the egg yolk, ablating or contracting a very superficial layer of the eggs without damaging or affecting the deeper layer of that yolk. It implies the very precise nature of the J plasma. In this talk, I did not include the other regenerative tools like the PRPs or the MSCs, or even the lifestyle tools like the long fasting and producing skin tightening. I just focused on the heat-based technology after body contouring. However, we have more tools than what we have 10 years ago in producing mild to moderate skin tightening after those procedures. That could save potential patients who are not very strong candidates for tux or lift, or are not willing to undergo skin removing procedures. I will talk about the other technologies in a different presentation. Thank you, and we'll talk more later.